This is Dr. Benzinger on health with secondopinion.org. Today we're going to be discussing anxiety. Anxiety is something that many people suffer, not only by itself, but with other types of conditions, such as depression, eating disorders, and many other types of situations, such as pain and emotional trauma that seems to make anxiety a much worse situation in your body, in your system. It's characterized by excessive and exaggerated anxiety and worry about everyday life events. Things that seem to be minor to some people, molehills, become mountains to the person who suffers from anxiety. And often people with anxiety always expect the worst and can't stop worrying about health, money, family, work, and or school-related problems. But here's the thing I want to encourage you as to. Even with anxiety, it is not out of your control. The perception is sometimes, doctors as well as the medical society has sometimes made you feel like it's out of your control. Well, let me tell you, there's hardly anything out of your control totally. There are some exceptions. The point of it is, I want you to ask yourself a question. Will you choose to control your own future, or will you allow the control of the rest of your life for this disease or this condition to control you? Are you willing to do the work to try to do something exceptional? That's what today's about, is at least give you information that can start helping. Here are some of the symptoms of anxiety: excessive and ongoing worry and tension, unrealistic views of problems. You've met people like that, haven't you? You might live with somebody like that. You might be somebody just like that too. Restlessness or edginess, feeling all the time they just can't settle down. They're irritable. They're just hyper irritable. They're always flying off the handle about small things. Muscle tension, they can't relax. They sweat easily. By the way, you don't have to have all these. You can just have some of them. Difficulty concentrating and just queasy stomach, nausea. It continues to need to use the bathroom frequently, have to urinate constantly. It's like your bladder's tight, it can't relax. You're tired all the time, but at the same time you have a hard time falling asleep and a hard time staying asleep. Sometimes actually you feel trembling inside, just like welling up with anger for no apparent reason, which anger anxiety disorders or dysfunctions apply themselves and actually come together frequently. And being easily startled, you have to knock and march up the steps to not startle the other person, because you walk in the room and they don't know you're there, they're going to hit the ceiling, okay? And usually respond in sometimes anger or crying, okay? The types of anxiety associated with the condition can be panic disorder, obsessive compulsive disorder, and certain phobias, depression, abuse and or addiction of drugs and alcohol. These are things that are associated with anxiety, not always, but in certain cases. We won't be covering them in detail, but I wanted you to know about them. What seems to cause anxiety disorder? Genetics play something. There's nothing been pinned to it at all. Some make suggestions of it. The truth of the matter is they make suggestions that everything's genetic. What we know is 5% of all conditions, heart, cancer, everything else, on average, are genetically directly linked. And 95% of them are, frankly, a healthy genetic structure that ends up developing these habits from other reasons. Brain chemicals can be one of those. Some people have brain chemicals that may be abnormal, but this is a hard one to prove in any individual. You ever had somebody diagnosed with anxiety disorder or depression, and you ask, well, where's the blood results showing my brain chemistry that's all messed up? Why can't they draw those chemistries and show them to us and tell us what's going on? The truth of the matter is they can't, they don't, and that's why often most of this is pigeonhole based only on symptoms. Environmental factors seem to be the big issue with anxiety. Trauma, stressful events get my vote as the most common cause of this condition or symptom, and it can be some trauma that happened from the time you were young to something that happens very late in age. I have a gentleman that's in his 70s, and he lost his business and then started developing anxiety and claustrophobia that he never had before until after this in his situation was a terribly traumatic event. Life-changing events such as a loss of a spouse, job, mother or father, marriage, child, a new child, divorce, or many other types of things. These are life-changing and can create anxiety disorders. So we had people just get married, have a baby, and all of a sudden they got anxiety problems. Didn't happen before, but did after that. Cause and effect. So the question is, will you choose to control your future? Will you? or will you choose to let the disease or this condition control you? Many actions can be taken to help fight this thing and do something about it. And conservative treatments, for all mild to moderate cases, we find that these are, if they work with qualified people, okay, they seem to do better without medications. In fact, frequently, right now we know that 85% of the time people get put on medications for anxiety, depression type of symptoms without ever being recommended to a counselor. You tell me how common sense that is, even in mild and moderate cases. How many of you want to be paying money and have side effect medications for the rest of your life without even trying to work through the reason that you're having the condition in the first place? And it doesn't matter if you had it 20 years. You might find the right therapist that finally gets you over the hump. I would rather put my money there, okay? So find a qualified one, a therapist, counselor, minister, psychologist, psychiatrist without medications first, if you can. If it's severe enough, you have no choice. You might have to be hospitalized. If it's severe enough, that's different. But then try to work backward and get yourself there. Somebody comes in with high blood pressure, 220 over 140. That's a life-threatening condition potentially. We make sure they get their medications into the hospital, get cleared up, and then eventually try to find out why it occurred and try to wind them down until finally they don't have to have it, unless it's an ongoing condition that needs that type of support. Same thing happened here, okay? Here are some of the other conservative treatments that you can consider for anxiety. Energy work. Exercise is kingpin. Guided imagery is wonderful. Deep breathing and relaxation work. Light therapy, mostly in December, January, February, if you're in the northern states of the United States or in a country that's dark frequently like England, that it doesn't get that much sunlight, I found out. Massage therapy, meditation, omega-3 fatty acids, lots of those help. SAMe, S-A-M-E, yoga, acupuncture, general nutritional support, Ayurvedic therapies, chiropractic care can help in certain cases, herbs, homeopathics, and natural hormone replacement if you're in that after, if you've been had a hysterectomy, ovaries removed, and moved into menopause earlier, this might be a major reason for the anxiety and needs to be balanced themselves. The aggressive treatments, medication, 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 and then more medication. Do they need to be done? Sometimes, yeah. Are they overdone? We all know that they are. The truth of the matter is, unless you fight to ask questions to decide if you're a mild to moderate case, there are other options for you. When you are a severe case, you might not have any choices, but you still need to try the other conservative approaches in conjunction with the medications to try to fight back to a more normal lifestyle if you can. So anxiety, is it severe? Is it important? Absolutely. You need to recognize the signs first. That's the most important, and don't ignore them. Just kind of get over it. There's millions of people with this condition mixed in with all kinds of things, and they don't do anything about it and drive everybody crazy. And we don't want them driving you crazy, me crazy, or anyone else, because they might not. They feel awful when they're doing this stuff. Most people spark off. They don't want to do that. They feel awful later, and it really degrades them as a person. They don't like it. Well, the truth of the matter is, don't ignore it. Help them go get help. Encourage them in a positive way, not you're driving me crazy, I'm going to leave you if you don't, unless that's the last thing you've got left to use. Okay? Ask and seek treatment quickly, and the longer anxiety lasts without treatment, the more likely you are to get other diseases and other conditions. So thus, aggressively handling this is very, very important. This is Dr. Benzinger on Health with secondopinion.org. We'll look for you next time. Hope you enjoyed today's session on anxiety, and may God bless you.